In normal healthy cells, lipids called glucosylceramide, GL1, are produced within an area of the cell called the Golgi by the enzyme glucosylceramide synthase. These lipids are essential to health and provide a number of important functions, including cell growth and cell death. In healthy cells, these lipids are broken down in lysosomes by an enzyme, glucocerebrosidase. The role of the lysosome is to maintain balance in the cells by recycling lipids and other substances that are no longer needed. To help you better understand what happens in patients with Gaucher disease and how the different treatment approaches work, think of your cells as a conveyor belt. At the end of the conveyor belt, there needs to be enough workers to handle the workload, or there will be a buildup of boxes. Similar to the conveyor belt, when properly working healthy cells in the human body have a sufficient quantity of enzyme to break down lipids, they maintain balance in the cells. There is no buildup of lipids, and the cellular function is in balance. In patients with Gaucher disease, a lysosomal disorder, the enzyme responsible for breaking down lipids, is not produced in sufficient quantities. This creates an imbalance in the cell, and more lipids are produced than the body can break down. When we reduce the workers at the end of the conveyor belt, boxes begin to build up. This is what occurs in patients with Gaucher disease. Patients with Gaucher disease have less enzyme that breaks down lipids, causing lipids to build up in lysosomes. This leads to an accumulation of lipids, causing the cells to become bloated, and overall cell function is changed. These enlarged cells build up in different parts of the body, including the spleen, the liver, and bone marrow, which causes the symptoms of Gaucher disease. The goal of every Gaucher disease treatment is to reduce the buildup of lipids in the cells to bring the cell function toward balance. There are two classes of treatment for Gaucher disease: enzyme replacement therapy, ERT, and substrate reduction therapy, SRT. Both work to address the lipid imbalance in patients with Gaucher disease. One approach to address this imbalance of lipids is to add workers to handle the workload. In ERT, additional workers or extra enzymes are added to help break down excess lipids and bring the cell more into balance. Enzyme replacement therapy replaces the missing or deficient enzyme with a bioengineered version of the enzyme. ERT works inside the lysosome to recycle excess lipids. Another approach to address the imbalance caused by Gaucher disease is to slow down the rate of production to help the existing worker better handle the workload. In substrate reduction therapy, lipid production is slowed to a level that allows the body's existing natural enzyme activity to better handle the workload and help maintain balance. Unlike ERT, substrate reduction therapy, also known as SRT, is designed to slow down the production of lipids to allow the patient's available enzyme to better handle the load. SRT works by slowing the production of lipids to a more manageable level so that the body's own natural enzyme activity can better break down the lipids.